r/AskReddit. Doctors of Reddit, what was your "this person is obviously fucking lying" faking moment? I've tested the hearing of a few kids, like 10-12 years old, pretending to be deaf in one ear. All you do is turn on your microphone and talk in the deaf ear at a quiet level and ask them a question about something they care about. Like young boys, for example, always fall for it when you ask them what video games do you play? At 20 decibels. Works every time. This is off topic, but a bartender once told me that if someone looked underage trying to buy alcohol, he'd ask to look at their hands and say, "Nah, you're not 18. All the actual minors would be wide-eyed and incredulous and ask how he knew just from looking at their hands. All the 18 plus would call him out on it. Had a PT fake a ruptured ectopic pregnancy to get narcotics. Says she was diagnosed with an ectopic at another hospital and given medication to end it. Came into our hospital in extreme abdominal pain, rolling around, yelling, had vaginal bleeding, the whole 9 yards. Gave her a bunch of pain medication so we could get an ultrasound. Ultrasound showed nothing. Urine pregnancy test showed nothing. B2HCG was 0. Turns out she was conveniently on her period, which made the whole thing very convincing. Got records from the other hospital. The patient had been there yesterday but was not pregnant for them, nor was she diagnosed with an ectopic pregnancy. Definitely was a wow, she just made up this entire thing. We had a lovely conversation about all the results. She ended up screaming at me, threatening to sue me for all I'm worth, and stormed out. Joke's on her, I'm worth 200k of student loan debt. I'm so poor I'm not legally allowed to die. Students. Not mine but my mother's, an ER doc at the time. Scruffy guy, mid-50s, comes in looking for non-specific help. Confused, smelly, dressed in ragged mismatched thrift store suit, clearly homeless and just looking for a bed. Keeps muttering something about quantum, obviously a little off his rocker. Mom decides, might as well give him a workup and teach the residents. Turns out the guy's in near total renal failure, so they give him dialysis. Snaps to. Suddenly coherent. Suddenly sane. Suddenly talking about real actual quantum physics. Turns out he's a math professor. Some organ problem sent him into a mental tailspin on his way to a conference a month earlier, got off the train in the wrong city, been wandering the streets ever since, missing and presumed dead. They're not always faking. A common side effect of kidney failure is delirium. Mental illnesses are a common side effect of a lot of things. God knows how many people are homeless and mentally ill because they're aging and have a potassium deficiency. EMS here. Had a patient start seizing in front of the cops after they were pulled over for possible drunk driving. We get there and the patient is still on and off seizing. We get them on the stretcher and in the back of the ambulance. Surprisingly, the cop joins us. As I take their arm, the shakes start up again, so I tell them, "Yo, if you want this medication, I need you to stop so I can start, and for real quick." Patient stops to let me start the line, and once I say I'm done, they start back up. You gotta say get the ocular needle and have someone else say you mean the one that goes in the eye? Then magically they will stop. A patient comes in saying she has terrible abdominal pain 10/10. I say okay. And start to examine her. She immediately starts screaming the moment I touch her belly. But look, I've seen patients in terrible pain, and nobody has ever yelled in pain with their eyes open. She wasn't even tensing or anything. It was a really sad case though. She has a history of coming in saying she was pregnant when the urine and blood test was clearly negative. In one case she even tried to steal a pregnant patient's urine. She got caught pretty fast. She was on psych follow-up, not sure what the diagnosis was, but my guess would have been Munchausen's. Anyway, we sent her home without pain meds. My second patient was a man with a chronic cough. Asked him, "Are you smoking?" And he says no, examines him and there's a cigarette pack right in his breast pocket. My second patient was a man with a chronic cough. Asked him, "Are you smoking?" And he says no, examines him and there's a cigarette pack right in his breast pocket. Technically he wasn't lying unless he was actually smoking when you asked him. Not a doctor, but a hearing aid dispenser in private practice. Had a patient come in for a hearing test, the young guy in his mid-20s, which is already unusual. The main issue is that he's getting noise complaints about his music. Huh. No issues with his ears physically, so I do the hearing test, basically ends up with a profound hearing loss. Weird because that's basically sign language territory there. I walk behind him and ask him what his plans are for the evening, to which he responds appropriately. Definitely what we call a non-organic hearing loss. He was trying to get the results he wanted to justify being a dick of a neighbor. Well, that is both clever and profoundly douche. Why? I hope you prescribed extra silent music as to preserve whatever's left of your sensitive hearing. So my mum is a doctor. She told me this story of a woman who came in and said she had been having seizures and as a result, she couldn't move her arms. So my mum tested her arms and tried to push it and see if she would react. The woman kept resisting and trying to keep her arm in place since she couldn't move it. My mom had to control herself from laughing and told the woman that she needed to relax. She then left the room and discharged the patient. When I was a kid, I fell out of a tree and tried to break my fall with my arm outstretched. Broke the arm. Dad came home and asked if I could move it. I tried but I couldn't. He moved it for me. He thought if it was broken, it couldn't be moved. Not a good day. I had the opposite happen to me. I injured my shoulder somehow and was in extreme pain. I also lost mobility in that arm. I couldn't raise it more than a couple of inches from my side. This continued for months before I finally gave in and saw a doctor. Got an X-ray and there was nothing notable. The doctor then asked me to move my arm as high as I could. I moved it a few inches from my side. He then asked if he could try to move it. He moved it a few inches and my shoulder locked like always. He asked me to stop tensing my shoulder. I told him I wasn't and was telling the truth. I was completely relaxed. I have high pain tolerance and was making sure to bear the pain and not tense. He tried again, and the shoulder locked once more. He then asked me to relax again. I once again told him I was. This happened a couple more times before he became frustrated and gave up. Apparently, my shoulder wasn't supposed to have limited mobility when someone else tried to move it, as my X-ray proved there was nothing wrong with the bone. That didn't change the fact that mine did. He didn't believe me. He simply gave me instructions to rest it. I just wish my doctor cared enough to find the real problem, so I could have received proper treatment. It took 3.5 years for that injury to heal, and I already know it will come back to haunt me when I'm older. Patient came in with seizures, non-specific weakness, lightheadedness, and numbness, tingling in her hands and feet. She gets admitted because of some electrolyte issues, not related to the neuro symptoms. These were corrected later and symptoms persisted. Sure enough, on the second day, she seizes. As soon as the diazepam is pushed, before the flush is even in, she stops seizing. This happens again 3 hours later. The third time while she was seizing, we took her hand and tried to drop it on her face twice. Both times she moved her hand out of the way so it wouldn't smack herself in the face. We just stood there until she got tired of shaking. It took about 5 minutes. She left AMA a few hours later. I feel like it must be hard to fake a seizure. I've seen a couple, and I'm just not sure how you would convincingly replicate that. I'm an EMT if that counts, so here's a good one. About 85% of the calls we receive, at least in my town, are issues where they clearly aren't severely injured. And just think, if I call 911, I'll get into the hospital faster. Pro tip, you still wait like everybody else unless you're actually dying. Another part of this percentage of people are ones that just want attention, medication. We had a woman recently that decided that she was gonna have a seizure in the ambulance. A real seizure, put simply, usually looks like they're just tensing up and twitching in one position. This lady was flailing every part of her body everywhere and trying to spit everywhere. Not only was it clearly fake, but we had to clean up the damn mess she made. We'd usually let it slide, but I pulled out a nasal airway and a lube packet and said loudly to my partner, we need to stabilize her breathing. I'll put in the airway in a second, just let me apply the lube so it doesn't tear open her nose like it usually does. The instant I said it, she stopped having her seizure. The unrelated story, but we also had another woman that claimed she couldn't get up after a fall in her house. We arrived at her entire house being locked, so we called through a window that was cracked to see if there was any other way inside besides breaking through her screen. She proceeds to stand up, go to the front door, unlock the door, walk back to where she was and lay back down. We did a generic checkup and there was clearly nothing wrong. When she said she didn't want to go to the hospital and we were about to leave, she stopped us and asked us to call Comcast for her since we are the EMS and are a higher priority. TL, doctor, fake seizures and faking an injury to have EMS call Comcast for you. Edit. Wasn't clear in the first post, didn't insert the nasal airway, just said that I was so she'd stop faking a seizure and making a mess. Reply. Seizure and